Okay. Okay, welcome to everybody. We're giving everybody a minute or two more to sign on. We should be starting in just a minute. Okay, the number of people that are signing on seems to have slowed down. So John, if you want to go ahead and give introductions.
Yeah, good morning, everybody, and thank you for coming back for the second round of input on this very important subject. What we hope you're learning from these webinars is that SDS must make changes to our residential habilitation services to ensure that we're in alignment with federal requirements around the way these services and settings are organized. To do that, we must clarify the differences between two of our most valued services, family home and group home habilitation services. We need to have dialogue about both in order to better clarify and organize how we oversee FamHab or family home programs. The previous webinar sessions were great and lively conversation, just the kind of input that we were hoping for. We did learn a lot of valuable lessons from those sessions and from your input, and made changes based on that input. And I want to emphasize again that this is an open dialogue. We are not proposing any regulatory changes at this time. Today, we want to review with you the changes we had made in our thinking based on the feedback from the previous sessions. We are also going to seek your input on a pair of bills related to residential habilitation services that are under consideration by the legislature. As we review these ideas with you today, it's hard not to be caught up in the real issues we're all struggling with due to the pandemic. Those issues are real and daunting. And it's important to reemphasize what I've already said. This is pre-regulatory work. And if and when we decide to move forward to do the regulatory work, this will take a significant amount of time, which would include doing the regulation work, going through the public comment period and the tribal consultation period. So any changes would be a long way off if implemented. And if you want to make additional comments after today's session, you're welcome to provide your input in writing, and we'll make sure that that's part of the summary that Steve puts together for us. And so please email us your input. And in a moment, after I turn it over to Steve, I'll go ahead and cut and paste the email address in the chat function so you'll have that. But with that, I'll go ahead and turn it over to Steve. And go ahead, Steve, take it away.
Okay, hello to everybody. I'm going to show the agenda. So given that this is an update on the sessions that we had earlier, we're going to start with kind of a review of some of the things that we went over during those 3 sessions. We apologize for those of you who were on those 3 sessions for it feeling repetitive, but we wanted to make sure that everybody had a common understanding. And then we're going to talk about the proposed changes. We're going to briefly summarize what we had proposed last time, and then the changes that we made based on the input that we heard from everyone. And finally, then we'll talk about next steps, and then Tony is going to ask for some input on some draft legislation. Okay, for those of you who don't know us, HCDS Strategies is a small consulting firm. We work mostly with state government agencies on their home and community-based services. We're working with a variety of states now, and we've been working with Alaska since 2006. Okay, and we'll open up the poll. If I can figure out that window. And Trevor, if you have access to the poll too, we'll get that going right away. Okay. Actually, Kara, we're launching the poll now. So if you can take a second and answer that, we would appreciate it. Okay, we'll just give you a few seconds. About 2/3 of you have answered. So anybody who hasn't, if you can take 1 second and do it, and then we will move on. Okay, and I'm going to close out the poll because last time we heard some people were having difficulty in getting the poll window from disappearing from your computer. So I'm going to close that out now. Okay, so we wanted to start with just an overview of the 24/7 residential habilitation services. There's two categories of those, the group home habilitation and then the family home habilitation. And within the family home habilitation, there are two versions of that, the child and adult, that have separate payment rates. Now they're available in the IDD waiver, the CCMC waiver, and the APDD waiver. All of these waivers are targeting children with, most people with IDD on it. In terms of the licensing requirements for adults, they are required to be licensed as assisted living homes, the ALH, which is licensed by the Division of Healthcare Services. And then for children, there's a community care license for foster children that is issued by the Office of Children's Services. Okay, now we wanted to kind of go over why we're doing this and kind of as a reminder about that. That under Medicaid regulations has a prohibition against the assignment of claims, that each provider must be Medicaid certified and enrolled, except in certain circumstances. And one of those circumstances is as an organized healthcare delivery system, or an OHCDS. And that option, to be able to do it, it has to be included in your approved waiver, and the state has to have set some requirements for what would be done under that. And that's something that we had talked about. We had talked about an administrative oversight organization. And one of the things that we'll be talking about is now is we're going to be referring that to as an OHCDS that will allow the providers to be certified through that.
Steve, you're not projecting.
Oh, it's not projecting the...
No, PowerPoint, no.
Oh, my apologies.
I was waving my arms, but you
No,
weren't watching.
Actually, it was showing it on my computer that I was doing it, but it was. Now are you seeing it?
Yes.
Yes.
Okay, thank you. Okay, so there's the prohibition of claims, and SDS have become aware that there were certain family home habilitation providers that have been allowed by the state to subcontract the direct services in violation of this requirement. Okay. Now, we had done some focus groups and a provider survey in late 2019, and that resulted in us identifying some additional challenges that we heard from the current family home habilitation providers. One of the things was that it was unclear what makes family home and group home habilitation different. And that's been a major focus of what we've been trying to achieve here, is to create more of a clear separation between the two. We heard also that the ALH requirement for adult family homes was overly burdensome, and that since the home had to become licensed as an ALH, it created a strong financial incentive to bill as a group home. We heard that some of the other certification requirements, notably the insurance mandates, were burdensome for family home providers. And we heard that the family home providers, they may not even know that they can be directly certified by SDS. Now, we had held 3 webinars in April of this year to discuss that. The first was talking about the difference between family home habilitation and group home. The second was talking about the licensing and insurance requirements. And the third was talking about having an oversight agency. And we're going to be combining all of those within this one seminar because we're providing potential changes that SDS has incorporated based on your previous feedback. Okay, now in terms of clarifying the difference from family home and group home habilitation, the categories that we have been looking at was who lives at the site, who provides the service, how many people are supported, and how residents' preferences are accommodated. Now, in terms of some of the changes on that, in terms of who lives on the site, we haven't proposed any changes to the family home habilitation, in that we're keeping it that the property must be the primary residence, that it's owned or rented of the family provider, and that the family and the participant live together at the same physical address, and the family and the participant share common areas. We did make some substantial changes based on your feedback on the group home habilitation. So right now, the requirements that SDS is considering is that all of the residents in the group home must be receiving paid services. It could be Medicaid, it could be GR, it could be other state, it could be private pay, or they can be paid staff. And then we changed the previous requirement, and I'll talk about that more on the new slide, on the next slide, but we changed the requirement and have another requirement to try to help to delineate that we're wanting to get your input on. And that the changed requirement is that the owner and operator cannot live in at the licensed entity unless the staffing of the home includes at least 2 full-time employee equivalents. So it doesn't necessarily have to be 2 people that are full-time, but it's 2 FTEs. So that could be split amongst more than 2 employees, with full-time being defined as 40 hours per week. And those employees cannot be immediate family, which we're defining or proposing to define as parent, parent-in-law, sibling, child or grandchild of the owner-operator. Now, the changes from that is we had language in the past that proposed that the staff in the group homes cannot live in the portion of the building licensed as the ALH. We got feedback from you all that indicated that it would be confusing to implement, and that we recognize that in some situations it would make sense to have staff live on the site. You guys made a very powerful case that you thought that, especially in the remote areas, having staff that could live in the site was essential to being able to staff a lot of the sites. So we tried to come up with something that would allow that, but still create some delineation between family home and group home. So now we're thinking of it that you can have live-in staff. There's no prohibition on that. But if the owner operator is living on site, then a substantial portion of the support has to be provided by paid staff who are not family members. Okay.
Steve, I have a question just for clarification for the audience. If they have a question that they would like an answer to, would you prefer they put it into the question and answer period? Because if we can't answer right now within the webinar, we would come back to it with a response. Would it make sense? Or can you get that out of the chat as well?
Yeah, we can try to grab it out of the chat. I think the questions would be workable, but actually,
it might be best if they put it in the question and answer portion?
Yeah, we can, if you type it into the question and answer, then we can track that more easily.
Okay, that was my question. Thank you.
Okay. Okay, yeah, I'm seeing that there's one very, very long comment in the chat that I don't want to take the time to read it, but if one of you guys can read it, and if you want to summarize it or provide a response, you're welcome to.
Yeah, I read it and I'm not sure I completely understand it, so I have to reread it, and then I'll either try to put a response there or we'll get an answer to you after the webinar.
Okay.
Thank you for the question.
Great. Okay, so the next section was who provides the support, and we updated some of the language. So in the family home habilitation, the vision is that the family is providing the majority of the services, that the family home habilitation provider cannot provide any other paid services to their resident. And that other current policies will remain, such as the resident may receive other waiver services, and foster children may receive PCS services. Now, for group home habilitation, the vision is that the group home staff that provide the majority of the work cannot provide other services at the same site. So that the day, for example, like if you have day habilitation that is being provided to the individual, it would be provided by separate, unique staff, and that only staff who are not providing group home services at the site can provide other services. Okay, so the changes that we made was we removed the phrase that was saying that people cannot hire people to provide direct services in the family home habilitation. We heard a lot of feedback from you guys that in some cases it makes sense to hire a homemaker or hire somebody that might be doing landscaping, and it wasn't clear what was direct services. So we removed that proposed language from it. And then we also removed some of the language that would prevent family home habilitation providers from providing other services. But we did want to clarify that they cannot be provided, or that they can be provided, but they just cannot be provided to their own residents. Okay, and there's a question coming saying, what if a home only wants to have 2 people living there? Why would it be necessary to have a full-time employee versus the owner? And does somebody from SDS want to answer that, or do you want me to take a shot at answering it? Okay. Well, I'll take a shot at answering it. The vision is that if you have a small home that's just 1 or 2 people within it, that would be more of a, and it's the owner who is providing the vast majority of the support, that would fit more with the family home habilitation model. And would be more appropriate as family home habilitation. But the group home would be more of a model in which you have more shift staff that are providing the majority of the support. That's kind of like one of the key areas that we're looking to try to separate for what makes it family home habilitation versus what makes it group home habilitation. And we do recognize that there are many situations. SDS has gone through a lot of the documentation that they have in the certification, and that there are a number of existing providers that are owners who are in their own home providing support for some people that are licensed as ALH, that this requirement would cause them to need to potentially shift to family home habilitation. So we recognize that's an issue. SDS is looking into how to be able to minimize any of the challenges associated with that. Okay, in terms of how many people are supported, there has been no changes to the proposed language. Under the family home habilitation, the vision is that it can serve 1 to 2 people. Potentially, it can serve more than 2 people with SDS approval. Situations like if you have 3 siblings or so forth that you want to keep together, those are things that SDS would be likely be approving for family home habilitation. And at a group home habilitation, that the group home is licensed to serve at least 2 people. Okay, and then there was a question that was put up there is, can we share any cost analyses that were done related to the group home staffing patterns? We would welcome your input regarding how that analysis might be structured. From SDS's perspective, it's relatively simple that if you have a family home or a provider that is just an owner operator who's providing care to one or two people within their own home, it's obviously going to be less expensive from the state than on the group home. However, if there's other analyses related to the staffing patterns or something that you think that SCS should consider as part of the analysis, we would welcome your guidance and input on how that should be structured. Okay, I'm going to go on to the next one. Okay, in terms of how residents' preferences are accommodated, there's no changes that we're looking to the proposed language. And this language is all necessary to comply with the CMS HCBS settings requirements. SDS does recognize that some of this is not currently, or that this is current practices. However, they want to emphasize that it's not currently in the regulations, at least not in this detail, and that in CMS, when they're looking at meeting the settings requirements, one of the things that they strongly encourage states to do is to have language in their regulations that that require these core factors that are consistent with the HCBS settings requirements. So SDS is strongly considering adding this language like this to the regulations. So in terms of the preferences for the family home habilitation, the expectations is that the participants are included in family activities such as meals and social gatherings, etc. That the family should be considering the residents' preferences for meals and other activities such as outings. You don't have to be just eating what the participant wants. However, you would be considering it. So if the participant really hates liver, then you would not be having liver every night, and you would be having more things that they would be liking, as you hopefully would with any child that you have. That the family should be considering the residents' preferences when setting up the shared space, and that the residents' room should reflect the residents' preferences. In terms of group homes, that the group home will have communal house rules that include the ability to set personal schedules, and that the participants' preferences should be determining the type and the timings of meals or and other activities such as outings. And that the ALH space in the group home should reflect the resident's preferences, and the resident's room should reflect his or her preferences. Okay. We got a couple of long questions within it. We're almost done with this section. So what I'm going to do is I'm just going to finish on the separation of the group home and family home, and then review the questions and go over them. Okay, actually we are done with that section, so I will go over that. Okay. Question from Jonathan Strong, who's talking about how
I answered Steve,
Sure.
and just said that I think we may need to take that back. We'll take his comments. I think one of the things perhaps that that is confusing folks is we're trying to separate between the difference between family hab and group home. And so when we're saying you have to have 2 FTE equivalents, we're just trying to say if the owner of the group home wants to live in the group home, it has to operate like a group home, and they should have 2 FTEs. And people are considering that a staffing mandate. It's not necessarily a staffing mandate. Doesn't mean you have to have 2 people there at all times. That's not what we're trying to say. We're trying to separate out the fact that family hab homes typically don't have employees or full-time employees, and they live in the home. It's a family. And so trying to build the sort of structure around that and separate that from what a group home looks like is different. And so it's not a mandate to have full 2 FTEs all the time in the home. So some of the comments in the chat or in the questions seem to be like, what if they don't have anybody there? How are they going to pay 2 full-time staff? That's not, we're not saying you have to have people there. I hope I'm understanding the people's concerns in that way. And again, we're fast reading here and trying to get through the questions. So we will definitely take a look at all of these and come back. Obviously, we appreciate your comments, and but that's sort of the premise. Like, we're trying to figure out, how do we structure, and we're open to comments and feedback. How do you structure a family home to look like a family home and a group home to look like a group home? They're very different. Group home has a higher rate because it is shift staff. You have more costs, you have employee costs versus the family home rate. And so we're open to feedback about that.
Yep. And remember that this requirement would only apply if the owner is actually living at the site. So if you have a site in which the owner is not living at the site, that this would not apply. Okay, Jonathan had the question about during this time of extreme difficulty, recruiting, training, maintaining, retaining staff, that we shouldn't be mandating the specific things. Again, this is something that is likely to be several years down the road. And we're certainly hopeful that the pandemic will be over by that point. Certainly the environment at that time, STS would be considering that. And if there is some other public health emergency on that, would likely add additional flexibility, just as they have during this pandemic. Okay, and then Jonathan said the use of the property should be explained in detail.
We can take that under consideration and figure out how we might describe that.
Yeah, it's talking about changing the word property to the certified setting or the licensed address or so forth on it. So nope, that's definitely good input on that we will consider that.
And Steve, this is Tony. Just like to add that that's the kind of input that was very valuable to us last time when we rolled out some initial ideas. So appreciate that, Jonathan.
Yep. And I think what we'll do, we're getting a lot of input on this too. So we'll go through some of the questions too, but we potentially could, if I'm seeing that there are some people that raise their hand too. So I'm gonna unmute or allow some of those to talk. So Lorna, you wanna go ahead and ask a question? And you're muted.
Actually, I did. I didn't want to ask a question. For some reason, it keeps raising my hand, and I have to following it. So I'm really not sure.
Okay. Oh well. Okay. Thanks. How about Denise?
It was the same issue.
Okay. Well, maybe it isn't a good idea to have people raise their hand because there seems to be like some kind of a quirk on that. Okay, so I'm going to pick up back where we are in the questions and answers. So Debbie was asking, if a staff provides group home 24-hour services for a few days, can that same person provide day hab on days not providing group home services? Not if it's the same staff. It can be different staff, or you can provide it in different settings. But the core idea behind that is that for people who are in a group home, that they have the opportunity to interact with a number of different people. So that it wouldn't just be the people that they're used to seeing at their home every day, that there could be other people from a day hab program that they can be interacting with and working with. Okay, Jennifer is asking, are you going to pay the family home provider when they take their client out of town on vacation? Or are you going to continue to penalize them when they allow the client to live a normal life by participating on overnight activities with schools or friends? So we're not proposing any changes on this to the current family home requirements. I'm assuming that you're referring to something that's currently within the regulations and that limits you on that. So we'll take that back to SDS for review on that. Okay. And then Maria was asking, some people do better in smaller homes. How can this be handled when it isn't cost effective for the owner? If it is really a small home that it's basically just the owner that is living with the person, that would be, it could be paid for, but it'd be paid for as family hab. If it is truly kind of a group home type setting, which you are paying for staff to be doing it and the owner doesn't live there, then that certainly could be allowed as part of the group home component of it. What we're just trying to avoid is when when somebody has somebody living with them in their own home, and it's them that's taking care of the person, them billing that as group home rather than family hab. Okay. Ali was asking, relative to the cost analysis, how is SDS determining the cost of care for 2 individuals in a family habilitation program versus group home costs? It's a major oversight at this point, clearly. I would think that for family hab, if you were taking care of 2 people, you would be getting 2 stipends for that individual. It wouldn't just be 1 stipend. You know, Ali, if there's other clarification that you would want in that, and I don't think there's any reduction that if you get less for the second. Okay, from an anonymous attendee, why are you guys doing this now? It's still the pandemic. We're not doing it now. SDS is not planning on doing it now. We're starting an input process so that when this is done, hopefully a couple of years from now, that we'll have good input on it, and that SDS is looking at this carefully so that these changes can be phased in over time. So, and the vision is that if there are providers that are impacted by this and have to change how they're licensed on that they will have a considerable amount of time to make that transition.
Steve, this is Tony, and I'd just like to emphasize that it doesn't seem like we can emphasize that enough, that we are this is merely a stakeholder input feedback process. These are not regulations. We do not intend to drop changes, particularly now while we're in the middle of a public health emergency. We're all acutely aware of that. And again, these are changes that have been a long time coming, that we've needed to make for a long time, that we've been looking at for a long time. And it's an ongoing process that's going to continue. So I just want to offer that assurance.
Okay, great.
The other, one of the other questions is about the rates. Why don't we just make the rates the same and call it good? Well, we don't establish the rates. ORR does that through very careful analysis. CMS would not want us to do that as well. I mean, we have to have a rate methodology to determine a rate. So typically with group home, when whoever submitted their cost analysis, when we developed the rate for group home, it was based on all the administrative burden that goes with a group home, with having staff, with paying unemployment insurance, with paying workman's comp, with all of those things that go into operating group home, which is much different than a family home where I might bring someone into my home and I'm not expected to have that same level. You know, we're trying to make it a simpler service so that we can utilize it more, because I think there's a very special niche for that, which is different from a group home where I might want to live. If I'm a recipient, I may want to live with my friends in a home and be supported in that home. It takes more to do that sometimes. So that's why we can't just pay the same rate and call it good. That would be simple. We'd love to be able to do that, but we cannot. So thanks for the question.
Okay, John was asking that as attrition happens with as it would with any business, what kind of time limit would be placed on hiring somebody new if an employee should leave? It hasn't been thought out to that detail, but that's an excellent point, that obviously there should be some flexibility so that if you have an employee leave, that you don't that you're not immediately in violation with the regulations. And that's something that SDS consider as if they go forward with this on additional ways that the operation should be thought through. So thank you for that question. Cindy asks clarification on who can provide day hab or other services who work in group homes. Like if you have staff at group home and works on the weekend only of group home A, can the staff work at day hab during the week while not working at group home A? They can work at day hab to group home B, but they couldn't be doing day hab for group home A. So if they, you can't be doing day hab if you're staff that's providing the group home services. That's the proposed change. Okay, John was asking, would having one 40-hour week or two 20-hour weeks be doable? Yes, they're defined as full-time employee equivalents. So it could be 2 people at 40 hours. It could be 4 people at 20 hours. Marcia was asking, why is that the live-in owner can't be a hands-on care person? They can be. They can be part of providing hands-on care. However, if you're building as group home, you have to have a substantial amount of the care also being provided by paid staff. Otherwise, if all of the hands-on care is being provided by the owner, then that's viewed more as being as a family hab. Okay, from an anonymous, actually from Michelle, you typed your name in there. Thank you. Clarifying that a provider agency running ALH as an entity would not fall under the two employee 40 hours. If you're billing as group home and you are the owner of that and you're living there, then that would apply. If you are like Hope and you have a home that is being operated that the owner does not live at, then the rule would not apply. Gabriella was asking, with the pandemic, there's been significant staffing issues. Again, this is not going to take effect for at least several years, and SDS has no intention of implementing this during a pandemic. Okay, Drew was asking, my understanding from the wording of the DHI staff must be separate staff and cannot provide any group home services, correct? At the same facility, yes, that is correct. That would be challenges to many of the agencies, large and small, to provide that staff and to build out the schedules. Many full-time employee schedules are built around providing support for group home and the day hab with most agencies. We appreciate that input on it. Again, the effort is to have individuals who are living in the group home not have the same staff day in and day out, and to increase the number of people that they're having the opportunity to be working with. Sandra was offering if you can ask clarification on who is the owner. And Lynn, did you want to provide any additional clarification, or would that just be who's listed as the owner of the business on the business license?
Yeah, we have kind of gone around on this because it's the owner operator. We've talked about how we might describe that because it raises questions for us as well. Owner is who is on the business license and who owns the property. I think that's how we left it. Honestly, I have to go back and look at our notes because we've gone back and forth on it as well. But
and Sandra, if you have any suggestions for how that should be defined, SDS would certainly welcome that.
Yes, absolutely.
Okay, Denise was asking, are you looking for different rates for different levels of care? That's not, go ahead.
That is not something that we're doing right at this time as a part of this project. it is something that we have done in the past, and we've talked about doing in the future, but that is not a part of this project at this time. But
Can I
thanks for-
chime in on that?
Sure.
So I'm a mother of a child that's severely disabled, and we were able to license the home as an assisted living home for her. So here's the problems that I've been seeing from like other people in my situation, is that when you have a child that's severely disabled and has a high number of needs, you guys are paying the same rate for somebody that has a high level of needs and somebody who does not. And so, the assisted living homes don't want kids like my daughter because they can't have, the quantity of people per staff, like she's pretty much got to be one-on-one. And so they don't want somebody like her. Like there's a gentleman that I know in Fairbanks who had to send his son down to Anchorage because he could not find anybody to take care of his child up there. So that's what I'm seeing. I will say that also my confusion between the FAMHAB and the group home, again, does not take into account the amount of care somebody needs. So while it would seem like we would be more of a FAMHAB situation, the amount of money that you guys pay for FAMHAB compared to a group home, it just makes it really difficult. It makes it very confusing as to what it should be. I think, if it was more like a level 1, level 2, level 3 of care, it would make it a whole lot easier, because you can't have a big group home with individuals that need a lot of care. She'll get up in the middle of the night. She needs diaper changes. She has behavioral issues. She can't ever be left alone. So I can kind of see, I don't know. I'm not really understanding how you guys justify doing the pays between the group home and the family homes.
Well, it sounds like in your situation that if you're licensed as a group home.
We are for 1 or 2 individuals. We're licensed as an assisted living home for 1 or 2 individuals.
Okay. And
being licensed is, let's just
Yeah.
be clear here, Steve,
Yep.
sorry. Being licensed is different than being certified for
Right.
a habilitative service. So are you
Right.
certified for family hab or group
Nope,
home?
group
Because
home.
because a licensed assisted living home is part of, it's not part of the certification process.
Oh, trust me, I know.
Yeah, I know, I'm just trying to make it very clear.
Yeah,
because
we are a group
confuse
home.
our
We bill as a
language.
group home.
Yeah, okay.
But for me, it's confusing because it doesn't, because we can't have a whole lot of individuals. It would really reduce the quality of her care if we were to have more people here. She really is like a one-on-one, but at the same time, if you take into account how much you guys pay for even a group home for 24-hour care, it only comes out to $13.75 an hour for 24-hour care. But, and if you do it as a 16, it's only like $24.25. So it's really hard to even, if we didn't want to be if we didn't want to be the ones to provide her care, and we wanted to hire somebody to come in, it would still make it very hard for how much care she needs, and that we're not able to bring on more people.
Definitely understand that and appreciate that.
Okay, good. I'm glad you see what I'm saying.
Yes,
And-
definitely do.
Have you ever applied to try to get the enhanced rate under the group home for her?
I have not. I've read about it, and it seems like it would be very difficult for us, because it almost seems like it would be somebody with medical issues that needs, round the clock monitoring, not just, she's getting up in the middle of the night. You need to get up and change her diapers, give her some meds to hopefully try to get her back to sleep. You know what I'm saying? And so,
Yeah.
but if you look at wage an hour, if somebody, the employee, if they do not get 5 hours of uninterrupted sleep, that counts as 24-hour care. So if she's waking up at 1 or 2 o'clock in the morning, that would have to be 24-hour care.
Right.
And my goal is for her to be able to stay here, whether we're providing her care or not, so that we can oversee it. I mean, I've heard enough of horror stories that I really am trying my best to not have to go outside of the home. And that even if we're bringing somebody in to provide her care, that, that way we're able to oversee what's going on and step in quickly if there's any issues.
We definitely understand what you're saying. I
Right.
would say reach out to the program for more information on that. But I unfortunately have to move on to the next topics here. We're
Okay.
not going to make it through, but
Okay.
we do hear what you're saying.
Okay, that's all I needed to say.
Yep.
Thank you.
Mhm.
Okay, let's advance. I'm going to ask, Checkwright was asking who lives at the site. Everybody residing in the group home must be receiving paid services. Would that require that all current and future spouses and children of live-in staff to move out or not be allowed to live there?
I think we would have to take this under consideration. It's a good point, Chuck, because I know there are some people that live there, but there are other full-time staff that work in the home as well, but they may have a son or daughter or a spouse that lives in the same home. So we would have to look at that and maybe make a revision.
Okay, yeah, that's great input.
Yep.
Okay, Maria was saying, sorry to ask this again, but if an ALH, if they only want a small group, say 2 or 3, because people do better in small groups, how can that be good for the homeowner to live in a home and provide services for the home? This makes it hard for owners to make it hard for people that need small groups. The owners need to be offset the cost by getting more people, and the people that have to deal with more roommates. But we welcome that input and we'll think about it some more. Okay. John Fitchett asked, why can't a family member provide services if a family member does not live in the home where the individuals are? Family members could. They could provide services to the individual. There's not a prohibition. There would still be that same requirement that if it is a group home and the owner operator is living there, that at least the equivalent of 2 full-time employees would have to be providing support.
I want to make sure we're clear on that. So we have sometimes a family member cannot be the provider of services. We would have to check regulation to make sure we're understanding that question correctly before we really answer it.
Ali was saying that the cost of family home habilitation is less compared to group home habilitation. Cost of doing business and providing services is still the same. That doesn't change. Presumably, if you were caring for somebody with your own home, in your own home, and not hiring staff and the other components, then the cost of running the family home habilitation should be substantially less. In addition, the cost structure is different in terms of group home habilitation is technically it's considered a service, and all of that would be taxable income, while the IRS generally does consider that for foster care that the family home habilitation can be considered to be a stipend, which may not be taxable. You'll want to check with your accountant on the individual circumstances, but that is another big difference between those services. Tabitha was asking if could the care coordinator determine if the home is truly a family home or group home, since they're responsible for submitting the plan of care. That's not something that, given the differences in care coordinators' opinions, I don't know if you'd want to put that on care coordinators, because
no, we cannot, because we have to assure the federal government whatever service we're paying, we've certified and that we have a qualified provider in place. So we can't leave that to care coordinators. Would love to be able to do that as well, but we cannot. So thanks.
Okay. And I'll go through a couple more questions and I'm going to move on to the other section. Since this process seems to be focused on reimbursements rates, I'd recommend that SGS focus on the difference between group home versus family home based on provider budgets and profit and loss statements. The providers could voluntarily submit their financial information, and that could help SGS to determine the family versus group home expenses. Group home expenses is significantly more than a family home, I would expect. SGS needs to be defining the service and setting the consistent expectations for what that service is across the providers. If you define it just based on what their financials are, it'd be significantly more challenging to operate, and it would create then incentives to structure your finances to be eligible for the more expensive services. SCS is trying to structure this so that there's more of an incentive to have two distinct services. One which would be a lower rate that would have more flexibility, and one which would have a higher rate and have higher requirements.
And again, for the rate questions, I would say we are in the middle. This is a rate, Jetta put it in the comments as well. This is a rate rebasing year. We need agencies that are on the hook right now for submitting their costs to submit those, so it can be rebased. And going forward, just so you all know, when we're looking at putting something like this into play, if we put a whole bunch of new requirements in, it would be something that we would want to look at, because we obviously want to be able to pay for what we're requiring. And so we would have to be able to say, yes, this is something they already do. We're going to take this out. We're going to put this in if we're going to keep the rate the same. Those are things that, you know, when you're implementing something like this and you're putting new structure in, we would have to take a look at it with the rates with all of you. So I don't want you to be too worried about that until we get there. Okay. We're trying to just develop what even the definitions might be and what makes sense to clearly define between family hab and group home going forward. But I think we have to move on, Steve. We're never going to get through our slides, and someone has asked for an additional webinar. We may be able to do that. Keep putting I would say keep putting all of your questions in the question and answer. This is great, because this helps us. We can go back. We can, you know, go back to and maybe do another one.
When our plan also is just to kind of go through all of the questions that we have in here, integrate them, the ones that are common ones, and then come up with answers that could be sent out. So I'm going to go back to the slides and through the remaining sections. In terms of the proposed changes to the certification requirements, that for the family habit, looking at changing the type of amount of insurance. We heard a lot of input from you guys about that, and that the current insurance requirements are problematic. STS is exploring what can be changed about that, and being able to have something that is more reasonable for family home habilitation. And they're also exploring, based on your feedback, whether or not liability coverage that covered under your homeowner's insurance could be acceptable. We had raised last time about the business license, when we heard overwhelmingly that the business license wasn't really a challenge, that it's just a $50 fee that is relatively easy to do each year. So STS is going to continue to require having the business license. The biggest thing that we heard about was changing the ALH requirement for adults. And you know, that was something that STS believes is kind of a core thing that they need to do to be able to implement the other changes, because if they don't make the ALH component easier for the family home habilitation, it will be harder for providers to be able to make this workable. So STS is exploring creating a new licensing category for adults through statutory or regulatory amendment. It may be a subcategory of the ALH license, like an ALH light license. They've been having extensive conversations with licensing and exploring a variety of different ways potentially to be able to do this. For the group home habilitation, there was no changes to the insurance requirements that were proposed. They'd still have to have the business license, and they'd still have the ALH requirement. That there still is the plan to have the oversight agency, based on what we had heard from the webinar about the things that were important to include. That one would be ensuring providers meet the certification standards, providing technical assistance to providers, conducting some on-site monitoring of providers, that they could bill Medicaid on behalf of family home habilitation service renderer, and that they would be assisting in the remediation of critical incidents. We removed them acting as the insurance holder. We got very negative feedback during that in the previous webinar, so we kind of took that off the plate. And Now, SDS is planning on having this oversight entity to be an organized healthcare delivery system. And that would allow the family home habilitation providers to be directly certified. You could be directly certified as you currently are, or you could be certified through the OHCDS. If the family home habilitation provider chooses to work with the OHCDS would help make sure that you meet all the licensing and the certification requirements. That each site would still have to be licensed with DHCS, ideally with a different type of license than the current ALH, maybe ALH Light or another category. They would then be certified by the OHCDS, but they would need to be separately enrolled in Medicaid. And they need to be separately enrolled in Medicaid because given the current information technology that SDS has, that is the only effective way to be able to see where each of the program participants are actually receiving their services. Now, the organized healthcare delivery could pass through the entire family home habilitation Medicaid payment to the rendering provider. And that is the vision, that it would be the entire payment. OHCDSs are often set up in which they do make just a sub payment of the amount for family home habilitation, but the vision is that the full payment would go to the family home habilitation providers to make this more economically viable. However, SDS is hoping to have then an administrative fee that would go to the OHCDS for performing these functions. And it's likely that there would be allowed multiple OHCDSs. Okay, so the next steps is we're going to be obtaining input on the Senate and House bill that Tony has asked for some time on that. Tony, how much time should we reserve for that?
Let's see, how much time do we have? We're going till 12:30, right?
Yep, so we have 33 minutes.
I think I can get through with my introduction in five minutes or less. So,
and for input, do you want to keep like 5 minutes for input or 10 minutes?
Yeah, I mean, I'm eager to, I guess we can just have people submit questions in the Q&A and we'll get to them as we get through the others as time allows. How's that sound?
Well, I'm just kind of thinking that we would answer as many questions as we do until maybe 12:15 or so and give you 15 minutes, or 12:10 and give you 20 minutes.
That's fine. 15 minutes should be fine.
Okay, great. SDS is then going to be working on regulations for the proposed framework after incorporating the input from this session. Depending on what we see from the session and the answers on it, that it's sounding like that SDS may be having another webinar to kind of going through the input and making sure that we understand all of your concerns and address as many of them as we can. Okay, and I'm going to go through some of the comments on them that we have, a whole bunch of them. You guys are always very vocal and we appreciate that. Okay. There was questions about whether the rates for family hab was going to increase because of this. This component is not considering the family hab rates. However, the rates are reviewed on a regular schedule and being updated, and SDS would be increasing them if they're viewed as being inconsistent with the expectations. Okay, what would be the case for a family hab home that has 3 residents currently and has for over a decade? Will they have to move out one of the residents? That almost surely would be no. SDS would, if you're currently doing it, they're talking about when they're having new family home habilitation sites and you want to have more than 2 residents, that SDS would look at that and approve it. They're not planning.
Yeah.
Go ahead.
Yeah, this is Lynn. We would, we're not trying to make these so that we move people or make people move from long-term residences. So we would always be considerate of that and adjust accordingly.
Yep. So it's very unlikely that SDS would do that. And certainly having people that have a long-term relationship and want to stay together would be a justification for having the 3 people continue to live together. Okay. Okay, there's Abby was saying that there are many horror stories of large agency staff-run group homes. Overall, as a care coordinator, I must say that the quality of the care in small family-run group homes is much better. This seems to be benefiting from larger agencies that have a bigger staffing pool to choose from. And you still can have a single group home that is operating as a group home. It seems like from an economic perspective for it that it would be very difficult to justify if you just had one person unless you had an enhanced rate. If you had an enhanced rate and you needed that, you would have an enhanced rate because you need that additional staff to do so. And hence you would meet the requirement of having the 2 full-time employees. And those 2 full-time employees is over the week. So it's not that you would have you would be required to have 2 people there, but if you had to have a one-on-one, you would be required under that to have a one-on-one for 8 hours a day, 5 days a week.
I think we're getting a little circular on this. I think we appreciate the comment. We'll take it under consideration. We need to move to the next comment.
Okay. Sandra was saying any analysis of existing cost surveys submitted to RR can provide information about the staffing patterns within group homes. Thank you for that. An anonymous attendee was saying if the owner operator does not live on site with the residents, can they provide group home services? So if they're not living on site and that's not their home, yes, they could provide group home services. It's only applying if the owner operator lives on the site. So if they're not living on the site, then the 2 employees at the 40 hours would not apply. And I'm going to go through some of the shorter questions now for time purposes on it. If a staff does not show up for work, can the owner operator provide these services? Again, with that, the 2 full-time employee equivalents, 40 hours, SDS would allow some flexibility for that. It's not going to be required that you have to have that every single week. That is just part of your general staffing pattern that you do have 2 full-time employee equivalents. Even when you have full-time employee equivalents, there's always people that are out for sick leave or on vacation or something as part of that. Maria was saying, as a parent, this really concerns me to find a small ALH. Not many people will be willing to do so, having 2 full-time employees. My child needs a small group home, but I see that as a big hurdle for the owners to keep them small. If you have a group home that has just 1 employee, it seems like that might be challenging, given that it's 24 hours care. But thank you for that input. Okay. Marcia was saying, what is being considered as grandfathered status? Under CMS regulations, once those regulations apply, if it's on the CMS side, they generally do not allow things to be grandfathered. We'd have to consider within if it's the state regulation, the ability to be able to do that or to have that allowed. And I don't know if JETA has a take on within your regulations if you allow for any grandfathering.
I don't know. We'd have to probably go to law for that. It's generally not. It's frowned upon. Yeah.
Okay. And what about the big agencies like Hope who have live-in staff, like a couple who live there? Will if they change their licensing to family help? No, that they would not have to do that unless the staff who are living there are the actual owners of the company. So if Hope decides to shift to a franchise model in which the owners, the workers own the actual sites, then that potentially could apply. But if Hope is the actual owner operator, they could have the live-in staff, and the FT requirement would not apply. Okay, Louise was saying, my daughter is in a group home with the owner providing 24/7 and providing services herself. The home is clean and the repairs are provided. My daughter and the residents are gaining informing relationships and her provider and the other residents. Well, presumably, it sounds like, Louise, that there's at least one of the residents, maybe two other residents. And it would seem that if they're taking care of three people in a home by themselves, that they would need to have some additional staffing for that and to be able to provide those services. And if they don't need the additional staffing, then it would seem that the family hab stipend should be sufficient. But if you want to provide additional information on that, we would be happy to consider it. Okay. And yes, we will be calling through the chat as after this and looking at those questions and seeing if we if there is additional questions and adding those to the things that we will be answering. Okay, Tyler was asking, can you have live-in staff in a group home without the need for an additional 2 FT requirements as long as the live-in staff are not the owner-operator? Yes, you could do that. Yeah, as long as the owner-operator does not live in there, then that does not apply. Okay, Lizette was asking, in order to maintain placements, it'd be necessary to have some sort of waiver for those providing services that no longer match the new regulations. And we will be looking into the ability to be doing some grandfathering and certainly the transition period if this is the direction that SDS decides to go. And that decision has not been finalized.
And I just would like to add on to that. Typically, we do not do a waiver of regulation like that or grandfathering in that particular way. And what we're looking for is not displacing a resident. It doesn't mean that a provider type won't have to change. We're not saying a person has to move because of that necessarily. And those are the things we have to consider always when we're trying to make a change like this. But thank you for the comments.
Okay. Amanda was asking if CMS is requiring individual provider licensing for group homes, assisted living, or is this a state proposal? I mean, for the group homes, for the ALH, the licensing is a state requirement, typically that those are licensed if it's going to be a group home, but it is set up of this as the state component. So, and sorry, Amanda, if you had something else.
Yeah, the state requires certification and licensing to be able to provide either one of these services at this time. That's what we're looking at is, do we do a lighter license? Is there some way we can make it a little bit more equitable for family hab providers to not have to jump through all the hoops that a group home has to jump through, but we may have the requirement that they have to be certified and licensed. And we tell CMS in our waiver application that that's how we're going to ensure a qualified provider. So CMS signs off on our ability to demonstrate to them that we are delivering services through qualified providers. So I hope that answers your question.
Okay. And Louise was asking, can a group home owner living on a premises have staff that stay on the premises for 2 people for 20 hours each? If you're going to have staff that were only working 20 hours since they're full-time equivalents, you would have to have 4. Okay. And I'm going to call through now. I'm going to go through some of the larger questions. Tyler was saying for some people being served in group homes, they could experience complex behaviors and emotional regulation issues, social anxieties that would make it unnecessarily challenging for them to receive day habilitation from staff who are less connected and they're comfortable with. This is not in alignment with the individual or person-centered perspective. That should not be allowed. Or they should be allowed to receive day habilitation services from individuals that they desire to work with and are most comfortable with. That's very helpful input. SDS can explore whether if they do adopt that regulation, that there may be some ability to grant some exceptions for people that are not comfortable interacting with multiple different individuals.
And this is Lynn again. I'm going to say something that's probably maybe going to hurt some feelings, but when we talk about this, it gets very emotional for many people because we are also considering the person's choice. And further back in the chat, we heard people say they can only fulfill a full-time staff if they also operate as the group home or the day hab person. So are you really in that scenario giving that individual choice in who they go out on day hab with? Or is it simply because makes business sense to the provider and to the individual giving the service? So we're trying to sort of figure out the best way to give choice, but also make sure that people really do have that choice, understanding that you guys are under enormous strain right now with staffing. So again, going forward, what would make sense in a non-pandemic time is kind of where we're headed. But I appreciate those questions, but I also want you to know where we're coming from, because we are thinking about the person's ability to choose who they want to go into the community with. And that's all I'll say for that.
Okay, I think this might be a good time to shift back to the Senate bill and let Tony walk through an explanation on that, and have you guys have a chance to weigh in on that.
Yeah, thanks, Steve. This is Tony from SDS, and we're going to, like Steve said, we're going to change gears here and just a bit, because we want to take a few minutes and get some feedback from you about a bill that was introduced and discussed during this past regular legislative session, and will be up for further discussion in the next regular session that begins in January 2022. So this might at first seem a little bit indirectly related to the topic we've been discussing. But as we proceed, hopefully you'll see why we thought this would be a good forum and a good group to discuss the bill. Senate Bill 98 and its companion, House Bill 119, which is identical, were introduced by the governor in response to requests he got from constituents who told him that Alaska needs a better way to enable youth with disabilities on a waiver and who are being cared for as foster children to be able to remain with their foster families when they reach adulthood, so that these former foster care youth and their caregivers can continue to live together if they choose, without being forced to make significant changes or disrupting their living situation and the supports they receive. So the bill does that by creating, as noted in number 2 here, a new setting, an adult foster care home that would replace the need for that family to set up as an assisted living home. The bill uses the term adult foster care home. Some other states use that term, but we've heard other terms like an adult care home, an adult family home, adult host home, that could be used to describe the setting. And the third thing here, the bill creates a new service called adult foster care, which would reimburse the family for the ongoing care that they are providing the child who is becoming an adult, and is intended to replace the foster care stipend that a foster parent received when the recipient was a child. So again, a new service for this population. To be clear, the governor's intent with the bill is to serve a small, specific group of individuals, okay, foster children with severe disabilities who are well served in their foster homes. Now, in the course of the hearings on the bill that happened last January through April, legislators asked us a question. They asked, would this residential setting type, an adult foster home, be of interest and value to others beyond those who are aging out of the foster care system? So that is, would an adult foster home that had its own licensing requirements separate from an assisted living home be of value in Alaska? And in that last round of stakeholder input that we got, and as Steve mentioned, we heard from some of you that Alaska would indeed benefit from a family home setting that doesn't need to be licensed as an assisted living home setting, but could be licensed as something else. So we asked the governor's office for permission to explore this idea further and see if you, our stakeholders, our partners, have thoughts or proposals on the bill that would enable it to meet this need. Okay, so Steve, we can go to the next slide. And to get us started in getting your feedback, I posted 2 questions here. So would there indeed be interest in making an adult foster care home available to individuals, and I should say adults, beyond those who are aging out of the foster care system? And if so, what would be the streamlined licensing requirements of an adult foster home? That is, what is it about assisted living home licensing that we could dispense with while still assuring that the home is a safe, healthy place for the individual to reside? So that's an overview of the bill. I'm going to pause there and see if anybody's got any questions or feedback. And I could use your help, Steve, in kind of figuring out where we've left off, if there is any.
Lizette was stating that her concern is it appears to be limited to providing transitions for individuals from foster care to adult foster care homes. So the question is, would this apply to individuals who have waivers but were not foster children?
Thanks, Lizette. Yeah, the bill right now is limited to people who were foster children. And what we're asking is, could there be a benefit for an adult? Let's call it something besides an adult foster home. Let's call it an adult care home for adults.
Great. And then Lizette commented that this type of service would have great value in Alaska and support better person-centered choice.
Okay.
Okay.
And Lizette, let me ask, and Lizette, please feel free to come off mute. Can you give me examples of who you could envision benefiting from this?
And Lizette, I'm working on finding you on the thing and unmuting you. So you should be allowed to talk, Lizette. Okay, and you are muted on your side.
Oh, am I unmuted now?
Yep.
Oh, fantastic. I would love to speak to this. I was very disappointed when I read the bill and saw that it was limited to foster kids, because I was thinking what a fabulous resource this would be for us to deal with and grapple with exactly what kind of created the bill in the first place, which is a number of the licensing requirements that family habilitation homes fall into are not one bit family centered. Folks aren't allowed to have more than $100 to go shopping. Menus must be posted. And then the stories of people having to redo their septic systems in order to meet licensing requirements that do not make a service more family centered. And on a national level, family habilitation is the direction that so many states are going in order to offer more family-centered services. So I feel like there are a number of ways in which we could make these regulations much more person-centered and make the setting of more value for the individuals receiving the services. I think this would be a great solution if it were to extend beyond just foster children who are transitioning to adult foster care. And thanks for the chance to speak.
Thanks, Lizette, for that feedback.
Great. Jeanette had a question saying, so can foster homes be dual licensed to serve children and adults for those children turning 18 who plan to remain in the current foster homes? I'm
having trouble reaching the questions, but I think that is something that we would need to work out with licensing in terms of a variance as to whether you could have adults and children in the home at the same time. So that's something we need to explore.
Tony, this is Craig with licensing. We routinely approve those types of variances. We work closely with OCS foster care licensing to make sure that it's appropriate. Occasionally there's conditions on the license, and then we coordinate with foster care and program when they are duly licensed for fostering youth with an adult child who was in the foster program aging out and needing assisted living services.
And thank you, Craig. And I think the bill does speak to some ability to make those sorts of variances too.
Okay, Maria was asking, will it work for kids that have been adopted through foster care?
I don't think it anticipates that right now. I don't think so, but that's kind of what we're wondering. Is it beyond the youth that are in OCS custody, moving into adulthood and leaving OCS custody? That's who the bill is aimed at now. And you know, I'll say in the governor's defense, he had some very impassioned constituents who were really concerned about these particular foster care youth moving and having to leave their homes because of the changes that occur when a family licensed as a foster home can no longer do that because they no longer have a child. So those constituents brought that concern to his attention. He introduced the bill to address their issue, but we're grateful that the governor's office has said, let us see if there are folks that might benefit beyond that very small population. And so that's what we're doing now.
And it sounds like this would be an issue of somebody who started out providing foster care to a child with a disability and then chose to adopt the child. As the child aged, would they be able to be providing that service? And it sounds like that's something to look into. Okay, Louise was saying, my daughter and most disabilities have social disabilities, communication problems, and difficulty accepting changes. With a stable provider that is living on premise, social communication and relationships formed, medication dropped. She has expressed the problem of high turnover with staff in ARC, bus drives, jobs, different support services. The 8-hour staff means more strangers that took more time. Sounds like that's a comment related to the earlier section. Okay,
well, it seems like the comments that I'm seeing are starting to go back to the more general issues, Steve, but yeah. I really want to emphasize that I am interested in your feedback on this. And this was a lot to take in just now. I will post a link to the bill in the chat if people are unfamiliar with it. I just want to be clear, while with the group home family hab changes we're talking about, we have a bit more time. There's not a pressing deadline. We do need to make any proposed changes to the bill to the governor's office here within the next several weeks. So Lizette, if you are able to gather up comments from your membership, and if other individuals are, that would be very welcome.
Okay.
And they can send those through to the policy unit as well, correct, Tony? If they're not working through Lizette.
Absolutely.
Okay. Great. So any other questions or comments? And, you know, we've got a lot of them. We've got, I count 79 questions in the Q&A, and then we'll call through the chat for additional ones, try to sort them to put the ones that we think are together on the same thing, and make sure that all of them are addressed or noted. Okay. Lizette said AAD would be happy to help you out, Tony. And Tyler was saying adult foster care can make made more accessible to have an alternative avenue for supports in addition to family home and group home. Okay, well, at this point, what I'm going to do is I think that I will we'll keep the chat and the Q&A open for a little while longer, so that people can enter that before we kind of close it out, but that we will stop the formal section of the webinar. So we greatly appreciate all of your comments and input. It's helping us to kind of understand the implications of the things that we are proposing, so that we can be able to refine them and make them better. So thank you very much. And I'm not going to close out the webinar right away. So anybody who is done, feel free to exit yourself.
I was just going to reiterate, Steve, to folks on the line, to you know, we appreciate all your comments, and it is again, prior to any regulation or real changes, we're proposing changes. That doesn't mean we've made changes. So I don't want people to feel panicked, because at this point in time, you know, we're all struggling to just maintain and get through day-to-day stuff, let alone add this on top of it. So one, appreciate all the time people took to participate in this and give us all of your thoughtful questions. You know, you do have the most expertise in the streets and in the homes and out in the world. And so we really do value that. And I can't say that enough. But I just don't want people to panic and think we're going to do this in a vacuum without you, because we're not. It's going to take us a long time, unfortunately. To make any changes, it takes us a while. So just appreciate all the comments and the thoughtful dialogue that we've had today. So thanks for doing that.
Yeah, this is John. I want to echo exactly what Lynn was saying. This is, as Lynn was saying, these are really proposals or proposed concepts that we wanted to have dialogue about, so we could really think about it and hopefully get it right. And just like the last sessions, we learned a lot from it, and I think we're going to learn a lot from this as well, and go back, regroup, and really think about what we're thinking about. And I do think there's opportunity to do this again. And we all know that we're in the middle of a pandemic, and we get that. And, you know, our capacity is also focused primarily on being responsive to providers and recipients during the pandemic. And that is our primary focus. And so this is something that we got in the works, and it's going to take a long time for us to really move this forward, because we are focusing on what's pressing now. But we do want to continue to take a look at this and have partnership with you, and look forward to moving these issues forward. And thank you.
Okay, as the input on the questions has stopped, I'm going to go ahead and end the webinar. Right?
That's typing.
Oh, okay.
Thank you. There.
Steve forgot to mute you again, so I can hear you clicking away, Lizette. Your picture keeps lighting up, so I know you got a question for us.
And my coughing, can you hear me?
I can't hear the coughing, just the typing.
Just the typing. Okay, thank you. I thank you guys so much. Thank you for hearing. Thank you for listening, and thank you for relieving people today, reminding us this is not imminent. That that is so big right now. Thank you.
You're welcome. So tell me when you're done.
I'm done. Thank you.
Okay, it doesn't look like it. Oh, okay.
Yep.
Great.
So I think I have 4 comments in a row in different
Yes.
categories.
Yep.
Yeah, I'm done. Thank you guys a lot.
Thanks, Lizette.
Thanks.
Appreciate it.
Hey, Steve,
Yep.
just the assurance that because some questions are in the chat and some are in the Q&A, that we're going to be able to have recorded both.
Yep.
Okay.
And thanks, Steve. I know that we continually ask people to move things over, but I'm glad that we're able to capture those that weren't able to, to transfer over their questions into the Q&A. So thanks for that.
Great. Yes, I've been working on saving that. Okay, I'm going to go and then end this now.
Thanks, everyone.
Thanks, Steve. Thanks, everybody.
Thanks. Bye.